When the temperatures are dropping, the nights are getting darker, and bugs and viruses, they're doing the rounds. In fact, this year, the flu season started a month earlier than usual, with a particularly nasty strain doing the rounds, and already it's landed some people in hospital, and that's before the winter pressures, which affect our hospitals and GP practices every year, really start to kick in. So throughout today, we're getting a snapshot of how the NHS in Cumbria is preparing for the busy period. As I mentioned a few moments ago, BBC Radio Cumbria's John Bowness is at a health centre in Carlisle for us. John, morning. How busy is it looking right now with you?
Well, it's starting to get busier, Mike. I'm actually tucked away in one of the consulting rooms at the moment, so I'll give you an update maybe a little bit later in the programme from out front, as it were, near reception. But obviously, like all surgeries across Cumbria, this is peak time of day to be starting to get busy. I'm at the health centre this morning, just to kind of set the scene for you. I'm off Eastern Way in Harrowby in Carlisle. It's one of 3 sites here that's run by Carlisle Healthcare. They have 25 GPs who look after more than half the population of Carlisle. It's not just GP appointments, though, that people come here for. There's all kinds of other specialists who are working together to try and keep people well. In fact, the practice has got 186 members of staff right across their sites, including physiotherapists, care coordinators, and healthcare assistants. And I'm with one of those other people now. Sarah Sewell is an advanced clinical practitioner. Sarah, good morning to you.
Morning.
Just explain, first of all, what an advanced clinical practitioner does. A lot of patients will come in for you for care, like I've done this morning, without really knowing in detail, what does that label mean and what do you do?
So for most of us, we've qualified in other areas, so nurses, paramedics, pharmacists, and then we've done additional 3 years of training, so that's at master's level. So essentially we see, treat, diagnose and prescribe. We can request further tests, we can do health promotion, and we look after everybody from kind of cradle to grave, really.
So is that, to an extent, could you be seen as sort of between a sort of a full GP and a nurse type role?
Yeah, so our roles very much is kind of that gap between, so we're nurses that have advanced skills or other clinicians that have advanced skills but are not GPs.
Tell me about why you wanted to get into the job.
So I've been a nurse for a long time, and I like the anonymity, easy for me to say, of being a nurse practitioner. So the patients come in, they're mine to look after. I can request their tests. I'm not having to go and ask a GP or another clinician for help and advice. I can pretty much look after them myself, and it's nice to be able to do that care without the need to kind of be directed on how we do that.
We know at this time of year, lots of people are getting flu and COVID jabs, and that's something that, you're experienced in giving. What's that like for people? Are some people, pretty scared either of how they might feel after the jab or just having the jab itself? Yes,
we see patients that are worried about kind of getting the vaccine, about what will happen at the appointment. Are they eligible? Are they not eligible? Especially for some people, so pregnant women, they're eligible, but they're obviously worried because they're pregnant But it's really important that people do get their vaccines. So if you attend for an appointment, you'll be asked, it's usually about a 10-minute appointment. You'll be asked a series of questions beforehand. We'll be asked you to roll your sleeve up, and then it's an injection in the top of the arm, which, like any injection, can be a little bit uncomfortable having it done, but it's over quite quickly. And typically afterwards, you get a bit of a sore arm. You can kind of have some viral-like symptoms, then they usually last 24 to 48 hours afterwards, which can be managed really simply. Keeping your arm moving is the really important part. Plenty of fluids and a bit of simple pain relief if you need it.
And I understand that the GP vaccination programme itself has ended for the winter, but people can still get jabs, and it's quite complicated who's eligible and who's not. How does that work? Who is eligible?
Yeah, so anybody aged over 65 is eligible. Pregnant women at any stage in pregnancy are eligible, and that's to protect mum and baby. And people with certain long-term conditions. So if you're under 65 and you have certain long-term conditions, you're also eligible. And children aged 2 to 16. So once we're at school, the school immunisation team do it, and for children under school age will be invited into practice for us to do it. Children immunisations is a nasal spray, so it's a little squirt up each of their nostril, and for adults it's an injection in the top of the arm.
Turning to health checks and the kind of things that you do on people, I'm a man of a certain age. Mid-50s, late 50s. Go on, just run me through. If you were going to do a health check on me now, as it were, live on the radio, I hope I don't regret saying this, but God, give me a quick try of what would you be asking and what would you be doing?
So things we'd think about is, what is your diet like? What's your exercise like? Do you smoke? How much alcohol do you drink? And then we'd think about some of the other things that are specific to men. So thinking about urinary symptoms, thinking about prostate, bladder, bowels. Have you lost any weight? Have you gained a lot of weight?
Yes, a little bit.
It's that time of year, isn't it, where we're getting ready for the festive season. And then thinking about other things. So we'll check your pulse, check your blood pressure, check your height and your weight.
Can we do that now?
Yes.
Just quickly, because I can see the time's ticking away a little bit. So you put in the cuff on there. I've already putting it around my upper arm. This one.
Yes.
Yep. And then about to pump that up by hand, presumably. So the cuff's around my upper arm. I've rolled my sleeve up a bit, or you go on, by all means. Because I'm holding a microphone in one hand, I can't roll my own sleeve up at the moment. And you've got the stethoscope on the inside of my elbow to hear my pulse there. What can you hear? What can you...
So when you're listening to blood pressures, you're listening for the beat of the heart, and then you'll hear that fade out, and then that'll be your top number, and then listen for it coming back in for your bottom number. So for most people, their blood pressure should be under 140. Yours is absolutely fine there at 136 top number and 78 at your bottom number, so totally fine. High blood pressure, some people, they don't know they've got it, so what's really important is once you're over 40, you should get it checked every 5 years. You can have that done at your GP practice, and now a lot of pharmacies offer that. So if you're going there for your flu vaccine to pick your medicines up, you can get your blood pressure check done by them.
Great. And just kind of in one line or so, what would be your bit of healthcare advice based on either the test you've just done or assessing me now?
So keeping them good habits, so making sure you're out, keeping active, thinking about your diet, thinking about salt and things like that, and reducing your alcohol if you're a drinker.
Okay. Thank you very much indeed. Sarah Sewell, thank you for that. That's given me something to think about and to work on. As you mentioned, Mike, I'm going to be staying here throughout the morning to get an idea of how busy it is and how GPs are preparing for the winter, hoping I might even get the chance to pop into the cafe before 10 o'clock. So if you're in the market for a homemade scone, Mike, let me know and I'll try to send one down the microphone to you.
Yep, I am, John. There we go. I think we've confirmed, yes, I am always in the market for a homemade scone. Nice one, John. If John's just having a bit of a health check, should he then be offering me a homemade scone straight off the back of that? I'm not entirely sure, but I'll take it. John Bowness at Carlisle Healthcare Centre. We'll hear more from John, actually, after 9 o'clock this morning. We are today, as BBC Radio Cumbria, looking at how prepared the NHS is in our region for winter. We'll hear back from John after 9 o'clock.